Hi everyone, and thank you for joining us today. My name is David Gomez. I'm a communications officer at PMNCH. And today, as you have accepted this invitation, we're going to be talking about the launch of our toolkit, which what we seek here is to empower you with assets that you can use to inform the general public into the current and latest statistics on preventable maternal, newborn, and child mortality. We're going to be sharing a set of slides where we first are going to start by giving you a little bit of an overview of how do people consume these kind of resources, how do they consume news, what is the trust that they have in news, and where the trust comes from, depending on who is disseminating this kind of information or news. And this is just going to give you a couple of details on social media in the current times. So I'm going to be sharing my screen. So if you bear with me for 1 second, I'm going to do that. Okay, so I guess you can see it now. All right, so let's dig into it. And I hope you enjoy and find this useful, which also what we're trying to do as well is to equip you with resources that you can later on also check on your own. These are very good resources and also that are drilled down into the country level. So if you are working in a particular country, you can actually go back to these links that we're going to provide on the chat and see how your country is doing specifically in your context. So what you will discover today, we divide it into four. So as I was mentioning, social media and the trust overview. How are we structuring our comms from PMNCH? And probably you can have some learnings from there, or you can adapt, you can improve, or you can also give us recommendations on what you think could be improved. We're going to let you discover our toolkit. We're not going to be focusing too much on the content of the toolkit today because you will have time for that, but more about how you can effectively use it and how you can actually take it, make it your own, and then share with your channels. And then we're going to give you an overview of the PMNCH advocacy calendar, where we will let you know what's coming up and also an overview for what's coming up for the rest of the year. So let's start with social media and the trust overview. So here we have this is a very, very, very helpful dashboard from edelman.com. And this is trust metrics that you can, right, you're seeing right now, it's coming from 2012 to 2025, divided into four different stakeholders. So governments, businesses, media, NGOs, which also include international organizations, which I believe most of us here are. And as you can see on this graph, most of the trust when it comes to news and news consumption is actually in businesses, private sector, and NGOs. So what we're trying to say here is like, look, people trust what they see that is coming from this side of the table. So that's why it's important that these messages, these important messages that give a picture and actually can show the emergency and the urgency that preventable maternal mortality have, comes from us as well. So we have the trust. You have the link here. We're going to share it in chat, as I mentioned, where you can actually drill this down to your own country and you can see how trust changes and who are the most trustable sources in your context. So I hope you find this helpful, and believe me, it's very interesting and you can actually gain a lot of important insights on this matter. Another thing that we wanted to share with you is this other dashboard from the Router Institute on Politics. Here we have an example of Kenya, and it's like how and where are news consumed. So this is, again, just as an example, and then you can actually go and check for your own country, where are these news coming from and how do people consume them. So if we see here on the left, let's stick with the Kenya example. Most of Kenyan people consume their news on online sources. So meaning that these digital tools and this information that we are here to launch today are likely going to be consumed if you put it there, out there online. You just need to find what are the right channels, what is the right time, what is the right format, so then they can be reached. So online, including social media, is there at the top. Social, just independently, not included on online, you can see that it has a 77% of a share of how people consume news. And then you can see that there is Slight decline on TV, but if you expand the timeline, you're going to see TV coming down quite a lot. And when it comes to actual print and paper, that's basically becoming quite obsolete at this time. So online resources, that's how people are consuming news. And as you can see in the graph on the right, then you can see what devices they use for news. So as you can see on the very top, you have smartphones, then it's computers, and then it's tablets. What this is telling us is like most people consume their news on a smartphone. So when you create content, when you're putting it out there, think phone first, think mobile first. What is it going to look best on a mobile? Because that's how most people are going to see it. And then you adapt to computer, and then potentially, if you have the resources, to tablet. But most of the time, and traditionally, sometimes we tend to look at things on our computer and then we adapt to mobile. But that's not how people are consuming these resources. So think mobile, think what's working, what's the formats, shorts, reels, TikTok. This kind of information, these kind of formats are actually now very, very trending. So how can we then adapt, or the way that we communicate, to these kind of formats that are how people are actually consuming news? Here, we're going to give you a little bit of social media statistics, just things to think about. This is part of a global report on social media. It's almost 600 slides that potentially you won't have the time to look at all of them, but it's very important information. And also it goes actually by channel, by country, how are people behaving, and the growth or not growth over time of social media use, time spent online, what people do online, how do people interact with their phones, how do they interact with video. It's a very, very interesting report. So we don't want to go too much into detail, but we want to make you aware that this exists, and then every year there is one. So on the chat, you're also going to have the link to this one. Feel free to explore, and again, get those insights and see what is useful to you. What we pick and choose for today as a very high level way of seeing things, it's audience by gender. So we can see that there is actually quite a heavy gender imbalance on how people use social media. And a lot of the ways that we communicate are potentially not thinking of this. And you can see male are actually the ones that have the most access to social media. So potentially we could also target our messaging towards that population, because they're the ones that are more active and they do have a role to play. Regardless if you're talking about mortality, maternity and pregnancy, etc. Men have a very important role to play, and they're the ones that are out there with or interacting with our content. The other one I want you to see could also is something that we need to strategize and think about, and is the social media use versus total population. So we can see the disparity that it exists, for example, from northern countries where 81% of the population have a social media account, versus what we can see in Middle Africa, which only 9.6% have. And even Western Africa, only 15.8% have. So yes, we are saying that most people there consume news online on social media, but not everyone has access to them. So how can we then reach out to them is a challenge. But the messaging is out there. What we want to communicate is out there. Now we need to be creative in a way. How do we reach them? Where are they, and how they can get access to this information as well, especially when it's information that is informing them on, best practices, things to do, access to healthcare, creating demand to the solutions that we are also very hard trying to implement. So this one, let's move over, and I stop with social media and dashboards and etc. So what I wanted to show you as well is how do people consume social media. So as you can see, this is data worldwide. You can also see it on this same report by your country. Here we see that Facebook actually remains to be the #1 social media channel. Potentially, a lot of us have stopped using Facebook. We're mostly using Instagram. I'm making assumptions here, but a lot of the times, and what I see a lot of in this ecosystem, is a big focus on X, or now, well, Blue Sky is also coming up. But you can see it's actually a very short or very small amount of the population that are there. So if we want to speak to the general public, it might not be the right channel. So we need to rethink, where are the people we want to talk to? So if it's policymakers, potentially X is a very targeted way to do it. Potentially LinkedIn is a good way to do it. But if you want to communicate urgency and talk to the general public, we need to revisit Facebook, YouTube, and WhatsApp. Everyone around the world, mostly, it's on WhatsApp. So how can we use our resources to get into those groups that become so viral, right? Like you get this from your families, you get information from millions of WhatsApp groups that you probably are into. So how you can actually capitalize on those as well to share an important message for you and that eventually will be for them. And lastly, on the right here, we can see how people use social media. In the top three, we actually see it to reading news stories. So a lot of people consume news in social media. They are not going to the outlets. They are not going to the website. They're actually going to social media to find their news or just to get bumped into them. And that's probably how a lot of people consume news nowadays. Even news outlets rely on that social media link where the people can see the headline, can see the important message, and potentially, maybe, they will go to the actual content. But that first impression and how people are seeking for news is on social media. So also another important takeaway, once again, I would like to invite you to go and visit these reports. They're very comprehensive. They have very important information that you can learn from and adapt your communications around. And you'll be surprised. I mean, there is a lot of learnings that you can take on your own. And we are also happy to then later on hear from you like, hey, we also find this interesting. Why don't you also try this or that or that? At the end of this conversation, we're going to share with you a QR code to join a WhatsApp group where we want you to interact with us, interact with the community, share resources, share events, but more details on that later on. So now going into more detail of what you're here for. So communications or communication of our objectives. So we are all on the same page. Something that we want to share with you as well is the way that we want to structure of communications. So a lot of the things that we do on social media only stop on the first column that you see here, awareness. But what happens if we're only making people aware of something? Nothing, right? There is no call to action. There is no action in it. So we need to also think of our communications almost as if it was a product. When you see a product, when you're working in advertising and you want to promote a product, you want to make people aware of it. Yes. But then you want it to convert, in this case, to buy it, to buy into it, to act on it. And then you want retention. You want people let's keep the analogy of a product. You want people to keep buying it, to become loyal customers. And in our case, to continue these policies, to not backtrack, to continue to be an advocate for what has been gained and not roll back. So for awareness, I'm just going to focus mostly on the key themes. So on awareness, so one is the urgency, that this is a crisis. And when you actually see health emergencies, we don't understand why preventable maternal mortality is not listed there when you look at the numbers. So we need to create a sense of urgency and actually drive demand for these kind of solutions within policymakers as well, because that's what they're going to be entitled to then communicate and to say like, hey, this is important for people. This is what is going to get me into the important positions of decision-making positions. So I need to talk about this and I need to tackle this and provide solutions for it. Now, also to show global solidarity and accountability. I mean, when you look at the latest maternal mortality report that came last week during World Health Day, you can see that a lot of the maternal mortality deaths are very focused on certain regions and countries. So that needs to be priority. We need to put the focus there as well as globally, of course, but we need to show that global solidarity and accountability. In terms of conversion, we're talking about policy action now. So we have a resolution. How do we transform that commitments into action and health strategies? Fund the future, of course, this needs resourcing. So through these communications, we are making sure that the funds are secure for the future. And we know where we are right now when it comes to funding. So very, very important. And hold leaders accountable. It doesn't mean anything when you make a commitment if there is no action on it, if they're actually not happening what they say they want to commit, they don't do what they said they were going to do. So holding leaders accountable. Part is how do you make your communications a tool for this. And later in retention, we're talking about tell us stories, how can we help, etc. So more to this, you will have access to these slides, and you can see also how PMNCH can help you and support your activities, your communications efforts, and make this a true partner-led initiative. In terms of channels and formats, I'm not going to spend too much time on this one, but it's also important to note and back up from what I was saying before, your channel and your format is always going to be depending on who you're talking to. So if you're talking to national governments, if you're talking to civil society, if you're talking to media outlets or journalists, what kind of channel works for them and what kind of format you need to build for them. So we are just sharing a little bit of what is internal to us. So you can also think of these variables when you are creating um, your own communication campaigns. So yeah, visit these, take it again, as you say, like you can build on these, you can improve these, you can adapt these, but think of it that not everything can be communicated the same way if you want to target different people. And in this space, we need to talk to different stakeholders. So keep in mind that your channels and your format will not be the same for everyone, but then how you can make the best of your communications efforts. Okay, and just last on this background before we go into a demo of the communications toolkit is make sure that you're relevant also at the country level. But it's all a circle, right? So when you're communicated at the country level, how that also helps and back up regional content. Probably we won't have the reach to have communications for all countries, but then talking about the regional efforts can also help amplify for countries that are probably a similar context. And then they can inspire action, which is also something that we want to do here. When you communicate things, just make people curious to say, like, okay, how is my country doing if this country is doing that? So having the regional content is also important, and how everything wraps up around the global stage. Of course, SDGs are we're talking about global targets, so we need to also communicate around those, but not focus only on those. So make sure, and if you can, if you have the capacity to contextualize these at the country and regional level, that would be very important. We're also here very happy to help. And you can see how on the communications toolkit, we have tried to focus a lot on that regional aspect, but most of you will have access to that next level, which is the country one, the country level. So now, again, for what you're here for, our communications toolkit, and I promise I'm going to stop talking in a very short while. The communications toolkit, something that I just want to emphasize is that this is a living document. So this is not static. We're launching it today. Some people have some access to it early, which has helped us also to make sure that we have information that is relevant, that is up to date, that you find the resources, the right resources, but also that you can also give input to it. And this can grow and become as powerful as it need to be and can be. So please feel free to use this in your own efforts, but also feel free to give us feedback, to give us more content. If you're focusing on a specific area of maternal health that you don't see here and you have relevant and important data, tell us so we can also adapt it and make it here and make it available for everyone. So how to use it? 3 steps. You can download and customize, share on your own channels, and then edit and update when you need it. I'm not gonna go too much into detail. You're gonna see it on the demo that my colleague is gonna give us. But yeah, again, it's just not a tool. It's really a collaborative effort. We need your input. We want you to use it, and I hope that we together can make this a very, very powerful tool that anyone that curls around it can actually use it, not only in social media, right? You can take this and you can put it in presentations, in newsletters, in advocacy events, in presentations. There is an infinite way that you can use this. So don't feel limited to social media. These are infographics, these are styles that you can use on many different touch points in your day-to-day work. The assets, they all have a very similar structure that we want to present here. On the top, you have bold statements, clear numbers. So 700 mothers die during pregnancy or childbirth every day, right? That's bold, that's clear, that's what happened. Now we want to put that number also into perspective. So you will see across the toolkit that there are analogies that can help you understand what does 700 means. So in this case, it's 2 jumbo jets full every day. When you think about this, when you are on a plane and you see, imagine all that people times 2 every day, that's unacceptable. And it's a lot easier to give context to that 700 because sometimes the number can not really get you that visual representation, but when you have it, you're like, oh, wow, that's actually unacceptable. And on the bottom of the card, then you have call to actions, background information, key details. It will change depend on the card, but that's more or less how each card has been structured. The campaign and the way that we're going to be disseminating this, my colleague Kieran will tell you a little bit more about this, how every 2 weeks we're going to be switching focus, also very depending on what is the relevant at the moment, what opportunity we have. So if there is humanitarian safety, climate change, gender-based violence, so what's happening in that moment that we can then use this toolkit to utilize it. You don't have to mirror the strategy by no means, but we will try to be very consistent on what is happening at the moment, and that's how we will then push our communications out there. More on that in a second. So here I'm finally gonna stop talking and I'm gonna pass the microphone to my colleague Alan, who will give you a tour of the Trello board, which is the tool that we have chose to host this toolkit. So over to you, Alan. I have just give you permission to share.
Thanks so much, David. Thanks so much for being here today with us, sharing our toolkit and our elements. So I think that I'm already sharing my screen. So thanks so much for your patience. So this is our toolkit. This is the live document that we will be having for this campaign. You can see that we have different columns, like a column to where you can learn more about the toolkit. You can learn how to access these resources. Another column on getting started, like a glossary, like a frequent asked questions, and then we will have the tiles. These tiles that David just talked a little bit about. So we will have these columns divided by mothers, newborns, children under 5, and kids. And you will see that these tiles have been developed in a global perspective, and also in a regional way. Okay, so these tiles are in a GIF format, and they are very easy to download. You can download them here from the Trello board. And we also have some other columns where we have the causes of mortality, the burden of mortality solution, child survival statistics, and last but not least, we have the sources. So we want to keep all the information as precise as possible. So that's why you will have the sources to every single tile that we have in this Trello board. So I want to highlight once again that this is a living document, and we will be adding different items as time goes by. I want to share with you how you can use these templates and how you can add your logo. So you will find at the top of every single column a card that says editable templates in Canva. Okay, so we will click here. You will see the link that contains the cards, and you will see some instructions just in case you don't recall how to do the edition process. This will guide you through. There is a GIF that will give us an example on how to do the copy. So I will do a demo on that later on. I want to share with you how the tiles are arranged. So let's open this one, maternal mortality globally. So we will have on every single card, we will have the statistics per year. Then we will have the statistics per day, and finally the statistics per minute. So this applies to all these columns, and you will have a lot. As you can see, we have over 100 tiles that you can use to disseminate the message and to raise awareness on maternal, newborn child and mortality and morbidity advocacy. Okay, so let's jump into learning how we can update these tiles and add our logos. So we will open this card, we will click the URL, and we are live. So these kind of things happen. Let's wait for the link. Okay, just give me 1 second. Excellent. So now let's click where it says mortality. In this case, that's the link. And you will see that you cannot edit these tiles. So what we will be doing is to go to this button that says File in your top left corner, click in here, and then we will click the option called Make a Copy. So you continue editing. And then you will have the editable file because you made a copy. So this will be available in your Canva account. So now you can go ahead and add your logo and place it. And you can help us to disseminate this message. Now, something very, very important is that these styles are very flexible. So if you want to download them here on the template, from the template, if you want to download them from the template, we will click in the share button, and we have a lot of flexibility here because you can download them as a video, you can download them as a PNG, or you can download them as a GIF. So whatever works best for your communications and for your channels, you can use those formats. So thanks so much for being here. We are looking forward to hearing from you if you have any questions or if you have any comments on the toolkit. And please feel free to use the toolkit and keep raising awareness. Thanks so much, and I'll pass it on to David.
Over to you, Kieran.
Okay, excellent. So this is our communications calendar, and as David mentioned previously, it gives a theme for each 2-week period throughout the year, and then it outlines the different opportunities that we have in that 2-week period. And it's a partner-led communications calendar, so any partner can submit an initiative that they want others to highlight in their communications. So you can see for the period from March 14th through the 28th, we took advantage of the International Day for the Eradication of Racism and its effect on children's health. And we highlighted resources in the Lancet on the topic. So you can see for this 2-week period, we took advantage of the International Day for the Eradication of Racism, and we highlighted resources on the topic. And then during that time period, the UN IGME 2024 neonatal and child mortality estimates came out, and we released those in our communications vehicles. We had a lot of different social media messages around the theme, as well as the mortality estimates, and tied racism into that as well. And there was a G20 Health Working Group meeting that we highlighted, and South Africa is the host of the G20, and we have our Global Leaders Network of heads of states from African countries, and they had a focal points meeting that some of the outcomes from that were highlighted as well. And then in terms of media, we had different opinions and comments in publications. So how we must rethink the future of women and children's health, with our executive director and one of our partners. That was a lead-in to CPD happening last week. And in terms of voices, we're trying to highlight lived experiences in countries. So we're highlighting a lot of partner articles and stories and blogs. So we featured a lived experience that UNFPA had published, and also a lived experience that White Ribbon Alliance had published. We also do a partner spotlight every month. So Hennet was featured, and that is the partner of a collaborative advocacy action plan initiative in 10 countries in Africa. So we have a non-governmental organization partner on the ground, bringing various partners together to collaborate around advocacy for maternal, newborn, and child health in those particular countries in Africa where 70% of the burden of maternal health is happening. And also a Touchpoint podcast series was introduced, and we have those periodically throughout the year. So right now we are planning them monthly, and this one tied into the International Day for the Eradication of Racism, which was on the 21st, and the podcast came out on YouTube and Spotify later. And the one on racism featured Dilan Devakumar, who is the co-director of the Center for Women, Children, and Adolescent Health at University College of London. So a partner is always featured. We say an expert as and partner is always featured in those podcast episodes. And then we transitioned into reducing mortality. And that was a big week with the WHO launch of their campaign, Healthy Beginnings, Hopeful Futures, and the release of the WHO maternal mortality estimates, as well as CPD. And when we got to this week, the opportunity also included the IPU assembly, and it included various events at CPD. And basically, the thrust was that SRHR is an important consideration when considering health for all. And there was not a strong focus on SRHR at CPD, so we wanted to bring that into better focus. And then you can see that this goes on throughout the year. And right now we're in the time period where we're launching this MNCH toolkit. Kadi?
Well, I just wanted to ask a question for partners in countries. So you mentioned that all of this is living in terms of resources. If I'm in a country and I would like to have a resource developed for me, so not necessarily to adapt something that's already on the Trello board, but I'd like something produced, either a tile, or participate in a podcast, or have help with a press release, or work with the media. How can you guys help?
Well, I mean, we're a strong partnership of more than 150 partners, including in-country partners. So we can make the connections to either other partners or experts or media.
Thanks, Sharon. And in addition to that, and to all these people that are here with us, and those that probably are going to see this on demand, reach out to us. Like when it comes to social media creation, reach out to us, give us the data, give us the resource. So all we need to do is to make sure that it's a trustable source, and we can help you with the creation of that content. And if we see that is something that we were missing out and it's part of a report that we can actually expand to other countries, we will be more than happy to also help you and collaborate with you to make sure that you have the right materials to do it. In terms of media, PRs, opinion pieces, again, also reach out to us, especially if you already have some contacts on the media. If you need help with the editorial, we can co-brand, we can co-create content. So again, very, very happy to coordinate with all of you. If you have ideas, if you have content, reach out to us. We will put our emails on the chat as well. And please, this is the idea, that you can also count with PMNCH to create this content, and that is not only for you, but also we will be inspired to potentially create content for other partners and other countries if we find it the relevant information next to it. I think we are about to finish this. I think we're overrunning just a little bit, but I just want to close with something very quick, which is something that I promised at the beginning, which is our QR code for you to join our WhatsApp group. So it's a very informal group focused on communication colleagues where you can tell us about your events, where you can give us ideas, where you can, if you have found a good report, something that you want to share with the community, this is a good place for you to do it. We also try to use this WhatsApp to keep you informed of activities that PMNCH is hosting. Like some of you probably learn about this launch through that WhatsApp group, and we'll keep you also updated. WHA is just around the corner, and then we also get to let you know what is happening there for women, children, adolescents health, as an example. I leave it there for another 10 seconds, so you have time to scan it. Okay, so thank you so much. Thanks for these minutes that you have given to us. And I really hope that you find this helpful. I really hope that you use it. And please, again, do count with PMNCH to help you if you have ideas, if you have stories, if you have data points, if you need an infographic, come to us. And we're very happy to help you and to make it available also for other partners out there. So thank you so much. And I hope you have a lovely rest of the week.